This is my Women's Health Pocket Guide. So for week 1 gastrointestinal, I saved the hepatitis labs. I feel like this is super helpful. Even as a nurse, like I work in primary care, and whenever we get positive hepatitis labs back, I never know like what's what and what to do from there. So this I feel like is so important going forward, especially as a nurse practitioner in practice. For ear, nose, and throat, in my primary care rotation, I found that a lot of patients would come in requesting treatment for sinusitis, and I think that that's common even in GYN. We would see patients that would say that they wanted antibiotics for sinusitis with like 3 days or 2 days of like sinus pressure, pain, or even just with congestion. So having this grid is very helpful if they're within that window of like having been sick for 10 days, tried all these things over the counter and nothing's working, or that second sickening. I think that this is helpful in determining antibiotic treatment. For menopause, in my clinical seminar with Jennifer Bankston, she gave us great information from menopause.org or NAMS and some of the Meno notes, which the two I found that were super helpful for me in practice were the hormone replacement therapy and then the one on vaginal dryness. For GYN cancer, I saved the DES exposure guidance. I found this to be super helpful. I ended up having a patient in practice, a clinical, who she was the granddaughter of somebody that had DES exposure. And then I actually did investigation into my own family tree and found out that I am also a granddaughter of my mom's mom had DES exposure. And I guess my mom had never really mentioned it to her primary care. So this I felt like was super helpful even in determining like what she should be doing. She didn't realize that she was supposed to be having yearly PAPs, and her primary care didn't either, so she ended up going to GYN. So this was helpful in practice and in my personal life. For vulvovaginal disorders, some things that we would not recommend in patients that have lichen sclerosis. I found this to be super helpful. I don't know if I can scroll. Nope, I can't. But I saved this chart basically of things that we would tell patients not to use. So like pantyhose, instead you should use stockings with a garter belt, thigh-high, knee-high stockings. Synthetic underwear, use cotton underwear, no underwear. Even with persisting like yeast infections, things like that, I feel like these are common spiels that I'm going on with patients regarding all of these things. So this is the screening, initiation for screening. It's a chart, you can't see it in this slide, but for breast cancer and mammograms, I felt like this was helpful as well as to when to order your first mammogram and how often you're screening. I saved the medical therapy to prevent fractures in people with low bone density for osteoporosis, kind of what medications to give and what labs to check. And then for anxiety and depression, I saved this chart that one of the other NP students shared with us in clinical seminar about antidepressant treatment algorithms for postpartum moms. I thought that this was great. I even sent it to some of my colleagues that I work with who see OB patients and postpartum visits, because I just felt like this was awesome. We do at where I work have psych in person there as well, but I felt like this was great, especially if you can't get them in to see psych. You kind of know what to do. And that is that.